Good morning, one and all. I'm Dr. Siddharth. I currently head the Department of Prosthodontics at SP Patel Institute for Dental Sciences and Research, Bida. I welcome you all to this master class. My topic is on restoration of endodontically treated teeth. So I wouldn't like to waste your much time. Directly, I'll be going into the topic. After this heavy clip, the presentation clip will be played. So kindly pay your attention into it. If you have any doubts or queries, you can always clarify them at the end of the presentation. Thank you.
Now, as I move on to the topic restoration of endodontically treated teeth, I'll be discussing on what are the rationale behind restoration of endodontically treated teeth, what are the indications, contraindications, what are the different types of posts that we are going to use, what are the interdisciplinary considerations, what are different types of co-build-up materials, what are the different types of armamentarium used in the post and co procedures, what are the armamentarium used in retrieval of post, and what are the recent advancements in this particular scenario. Coming on to the rationale, as a prosthodontist, restoration of endodontically treated is required mainly when we consider as an abutment for FPD or RPD or overdenture. As a restorative dentistry, the main goal is to increase the clinical longevity of this teeth. Squaz et al. Have found that the failure rate of endodontically treated teeth was most double in cases of with inadequate restoration. Now, what are the effects of endodontic treatment? As we know that once the tooth or teeth is endodontically treated, the vitality of the tooth is lost. As a result, there is loss of moisture, there are architectural changes within the tooth. Hence, the tooth has to be reinforced with a definitive restoration, as well as the radicular part of the tooth has to be. Now, basically, we deal with two terms when we speak of restoration of endodontically treated teeth. One is a post, one is a core. The ideal prosthodontic term for a post is called as dowel. Dowel is nothing but as a metal post or a rigid restorative material that is placed in the radicular portion of a non-vital tooth. It is, whereas core is a properly separate well substructure which replaces the missing coronal structures and retains the final restoration. What are the indications? When natural crown of a root-filled teeth either has been lost or is extensively damaged, or when the root-filled tooth is used as an abutment, loss of proximal surfaces, or when there is insufficient coronal structure of the tooth, or there is unfavorable periodontal or periapical conditions associated with the good oral hygiene of the remaining dentition. Contraindications when we have severe curvature of the root tooth, dilations of the root, persistent periapical lesions, poor periodontal health, fragile roots, patients with unusual and occupational habits, or when the restoration that we are planning has heavy occlusal contacts. Prognosis of the tooth, is the tooth worth saving, or will loss of the tooth significantly jeopardize the patient's occlusal function? What are the pre-operative assessments that first is endodontic considerations, periodontal considerations, as well as prosthodontic consideration. Now, this is of utmost importance to us. When we speak from a prosthodontic point of view, we see amount of remaining tooth structure, anatomical position of the tooth, functional load on the tooth, aesthetic requirements of the tooth. What is the classification? Now, according to Rosenstiel, when we speak of post, based on the shape, we have different types of post. It is tapered. In tapered, we have smooth post, serrated, threaded, parallel, same, smooth, sided, serrated post, threaded post. Now, ideal type of selection of post type. This is one very good classification given by Emmaden et al., where they describe as when we are going ahead with indirect technique, it has to be alloy based post. When we go ahead with direct technique, it is based on their shape or based on their material. So basically, as of now, the current trend that we follow is based on material based, whether it is stainless steel or aluminum or a composite or a fiber or a titanium post. Based on shape and all, in the earlier versions of post and core treatment, we used to use this kind of post, but ultimately what it led to is creating stress among the radicular part, which led to the failure of such treatments. Now, if you see this image, it basically depicts the radicular part is prepared to receive a post. Over the post, we have a core material, then we have a crown. So this picture entirely summarizes what basically is restoration of endodontically treated teeth. Now, prefabricated post and cores are available in market. It basically consists of a prefabricated post and cast and pour. According to the material compositions, we have metal post, ceramic post, zirconia post, fiber posts. Based on the type of post, what are the advantages and disadvantages? You can take down this slide, or you can take down a screenshot of this slide, but I'll tell you in a nutshell what are the basic advantages. Basic advantages of parallel is excellent clinical attention, minimal stress concentration. Now, why this stress concentration is essential? Because as we know, proprioception in the tooth is lost once the tooth is endodontically treated. So when we use threaded post, stresses are generated, and when the stresses are generated, it is not vented out. And when such kind of design is used, we don't use the basic principle of conservation of tooth structure. More amount of tooth structure is lost in this kind of design of preparation to receive threaded post. That is why the biggest disadvantage of threaded post is creation of stress in the radicular part of the tooth, which ultimately leads to the fracture of the tooth and ultimately leading to the failure of the definitive restoration. Then coming on to the carbon fiber post or ceramic post, these are the recent advancement. They have good advantages. The bonding is good. Ceramic post, they have good aesthetics, but again there are some disadvantages with this post. Like when we go ahead with carbon fiber post, we see that the strength is low, then there are chances of micro leakage, then the aesthetic demand is not met out when we go ahead with carbon fiber post. But when we come with ceramic posts, definitely the aesthetics is made, but it is uncertain about the clinical performance of ceramic post, because as of now much research has not been done into use of this kind of posts. Custom cast post and core, what are the advantages? Preservation of maximum tooth structure, core retention, and high strength. Disadvantages, again it is less stiff than your stock posts. Again, it is time consuming. Fabrication technique sensitive. But if we consider this as the gold standard of post and core rehabilitation, guidelines in post selection, we have something called as rule of thumb. The post should be not more than 1/3 the diameter of the root, with the root and walls at least 1 mm thick. What is the post size, post diameter, surface texture of post, number of posts? These are the factors that are to be kept in mind when we go ahead with selection. Now, coming on to the ideal requirements for a code, it should have adequate compressive strength, flexural strength. It should be definitely biocompatible, resistance to leakage of fluids, then ability to bond to remaining tooth structure, and it should have a minimum amount of thermal coefficient of expansion and contraction. Classification, as I said earlier, various classifications are there, but a simple classification of lead that we follow is cast core, plastic core. Under cast core we have metal ones, ceramic ones, or zirconia ones. In plastic core we have amalgams, GICs, resin modified GICs, composite resin cores. Now, a few guidelines that we need to follow once we go ahead with this procedure is similar to our basic principles of tooth preparation, that is conservation of tooth structure. When we speak of conservation of tooth structure, we need to speak about preparation of the canal, preparation of coronal tissue. Then again, what are the different retention forms? Different retention forms in anterior teeth is different, retention form in a posterior teeth is different. Resistance form is of utmost importance here, because it basically we are dealing with stress distribution as the tooth is non-vital, and rotational resistance to occlusal. Now, conservation of tooth structure. How do we achieve it? Basically, it is preparing your post space. Removal minimal amount of tooth structure from the canal. Excessive enlargement can lead to perforations or weaken the radicular part of the tooth. We need to evaluate how much amount of remaining dentin is left out, because that is directly proportional to your fracture resistance. Ideal requirements: enlarge the canal to fit the post snugly for retention and preparation of coronal tissue. It is a key element of tooth preparation when using a dowel or a post, and core is the incorporation of a ferrule. Now this ferrule is nothing but, in simple language, if I say US, it's a groove given in the coronal part to prevent any rotational movement of your dowel along with your core. Ferrule, as the definition says, is a metal band that encircles the external dimensions of the residual ferrule fit. What are the advantages of this ferrule fit? It increases retention, it increases resistance to fracture, resists your lateral forces, reinforces the tooth at its external surface, helps in dissipating the occlusal forces, lack of sufficient forces, the post and core to accept high functional forces, creating a failure. Extension of the axle of the crown apical to the missing tooth structure by either as by surgical crown learning or by orthodontic extrusion. Where do we do surgical crown learning? When there is reduced root length in what happens is it reduces the root length and increases the crown length. So what happens is, whenever there is less favorable crown to root ratio, increased leverage on root during the functional. Again, orthodontic extrusion also reduces the root length. Crown length remains unchanged, so more favorable crown to root ratio may be preferred to your surgical crown lengthening. So basically, this slide, what we can interpret as, orthodontic extrusion is an ideal procedure as compared to your surgical crown lengthening, because your crown to root ratio becomes favorable. Now, what happens if we do not give ferrule, or what happens when we give ferrule? Now, when we see a comparison within both, a restoration without ferrule is always prone to failure, primarily by debonding and subsequently by root fracture through lever action of the retention form. Now, retention form basically depends on the post length, post diameter, post design, canal shape, luting agents, luting methods, preparation of canal space, location of tooth in the arch. The factors that have been identified to affect the retentions of the post system. So you can summarize that these are the gross factors that can affect tensions of the post system, post length. Now, if you go ahead deep into the literature, it shows that when the post length increases, retention also is increased. However, the relationship is not linear. Now, what are the various concepts of post length? Preservation of 3 to 5 mm of Vatapachati apexes is something which we very often follow. Or the other thing is equal to inside the cervical or occlusal cervical length of the crown. The post should fit certain fraction of length of the root, 1/2, 2/3, or 4/5, depending on the different clinical scenarios. The post should end halfway between the crestal bone and the post diameter. The diameter of post is selected according to the root anatomy. A minimal dentin thickness of 1 mm around the post should be. Post design: preparation of both the surface of the post and canal surface can significantly improve the post retention. It is being followed for the past 2-3 decades. Air abrasion and notching of the post have been shown to increase retentions. Now, if you compare threaded post, are greater than your parallel post, again greater than your tapered posts. Now, parallel-sided or threaded posts have been found to be most retentive. Cemented parallel posts have been found to be more retentive than cemented tapered post. Cemented parallel post with serrations are more retentive than cemented smooth-sided parallel post. So ideally, we can conclude that if we follow this design, we need to follow that. We need to have a parallel post with serrated posterior teeth. Long posts are avoided because the complex anatomy of the radicular part of the tooth. Retention is better provided by two or more relatively short posts in the divergent canals. Cast core is preferably used. Then we have something called as split post, wherein because of different parts of incision, there are two parts of the post which are aligned on the occlusal aspect of the tooth. Resistance refers to the ability of the post and tooth to withstand lateral and rotational forces. Now, how does it get influenced? It gets influenced by the remaining tooth structure, post length, and rigidity, presence of anti-rotation features, and presence of ferrule. Rotational resistance, a small groove placed in the canal, can serve as an anti-rotational element. The groove is normally located when the root is bulkiest, usually on the lingual aspect. Rotation can be prevented by vertical coronal procedure. Removal of the root canal filling material to the appropriate depth, enlargement of the canal, preparation of coronal. Removal of endodontic filling material. It can be done by three methods. One is chemical, one is thermal, one is mechanical. Thermal is generally used, your chemical is by using a GP solvent. Thermal is by using O-arm condenser or your endopane and all. Mechanical removal is by rotary instruments. You can use gate and steel or piezo removers to remove the remaining GP. Enlargement of the canal. Calculate the appropriate length of the post. If GP put is old and has lost its thermoplasty, use a rotary instrument. Use custom-made post in canals that have a non-circular cross-section or extreme taper. Undercuts within the canal must be removed, and some additional shaping usually is necessary. Preparation of coronal tissue. After the post base has been prepared, the coronal tooth structure is reduced for extra coronal restoration. Anterior teeth requiring a post and cover are most effectively restored with a metal ceramic crown. Remove all and external undercuts. If insufficient tooth structure remains for this feature, an anti-rotation group should be placed in the canal. Post fabrication. Now we have direct technique and indirect technique. I will not go ahead in depth about it because we have read this little bit and when we have read with manipulation of in-lay wax and on-lay wax, but mind little bit about the steps wherein we make direct impressions of the post space. That is called as direct technique. When we do not make it, we go ahead and do it on a model, it becomes an indirect technique. Investing and casting of this, a cast core should fit somewhat loosely in the canal. A tight fit may cause again root fracture. Now casting should be slightly undersized because again keeping in mind the thermal expansions of investment material that is showing, it has to be slightly underlined. Extra hard partial gold alloys or nickel are used as your choice of alloy material for cast post. Cementations of post. Now, when we speak of cementation of post or luting of post, the first question that comes to mind is what should be the ideal choice of luting agent. But before going into that, we should know what it should do. The luting agent must fill all dead space within the root canal system. Voids may cause periodontal inflammation via the lateral canals. The post and core is inserted gently to reduce the hydrostatic pressure. If a parallel-sided post is being used, a groove should be placed along the side of post to allow excess of cement to escape. What are the different luting cements that can be used? 5 types of cements can be used: resin cements, polycarboxylate cements, glass enamel cements, resin modified and zinc phosphate cements. The most effective variety are glass enamel cements and resin cements. What are the armamentum that are used for retrieval of post, or what is the need for removal of post failure of endodontic treatment or improved design mechanism, or there is a aesthetic demand. Methods of post removal can be mechanical or mechanical is by using a Messerian kit. The method involves gripping the object through a tube or a driven with axle-like tube. Wise advantage, it is simple, little generation of heat, elimination of excessive forces. Then we have something called as eggless post removal. It basically it is used in case of anteriors and premolar. Its size prevents it from using in second premolars and virtually all premolar teeth. Again, then we have ultrasonic tips or ultrasonic scalers, which cause debonding of the luting agent from the pores, and in turn it becomes substantially easy for us to retrieve the pores. Now, what are the recent advancements? Recent advancement, we have various types of composite pores, silica fiber pores, light transmitting pores, ribbon fiber pores based on. Now, silica fiber pores, basically we have para pores, snow pores. These are the trade names by which these go ahead. You can take a screenshot. The slide is consisting of the various diameters it has, what are the composition of this pores. The light transmitting pores, the trade names are mentioned again in the slide. You can go ahead with the dimensions and all. It's very difficult to remember, but it gives you a basic guideline once you go ahead making a clinical decision, like with what kind of post I should go ahead, or what should be the ideal choice of the post or the material of the posts. Double taper light post. Now, little bit emphasis about double taper light post is that it provides close canal adaptation with minimal tooth structure removal by providing a subtle taper. Has fiber optic construction and can be cemented with light cure or dual cure materials. Bondable reinforced fiber post. Cosmo post. Now this is the most recent ones. It is ceramic post system indicated mostly in aesthetically important anterior region. Smooth post is subsequently treated to enhance bond strain between post and core, either heat pressed or luted. Failures. Most common types of post and core failures are post loosening, apical region caries, fracture of teeth, root perforations, and post dislodgement. How to avoid root perforations? Post should not extend more than 7 mm apical to the canal orifice and a molar. Piezo rotary instruments should be avoided, especially number 5 and number 6, that is ranging from 1.3 to 1.5 mm diameter. Gate dental burrs or drills, number 6 should be avoided because that is the largest in diameter. Recommended is heated instruments and G. Many authors feel that reinforcement with a dowel is mandatory if these teeth are to be used as an FPD or an RPD abutments. It is felt that pulpless teeth or non-vital teeth must be adequately reinforced if they are to be subjected to the demands of greatest stresses as abutments. Now you see various clinical cases where the ground root ratio was altered and post and core was done and a process was given. Various choice of materials. In this particular case, glass fiber post has been used. In the earlier case, a custom has been used. This is something, if you have a very good scanner which has a precision beyond 20 microns, then you can record the depth and you can go ahead and do a CAD/CAM fabricated post and core. Conclusion: reinforcing and restoration of broken root canal treated can be done with post and core system due to availability of prefabricated post of various designs and surface configuration. The fabrication time and cost have been reduced. For a successful post and core system, the clinician should keep in mind regarding proper obturation, post space, post length, post diameter of variable design and should preserve the root dentin as much as possible. Now, what are the take-home messages? The purpose of both clinically and laboratory data fail to support the concept that post-strand and endodontically treated teeth. The purpose of post is to provide retention for core. Now, some data. Clinical failure rate of post and core average failure rate is somewhere around 9% from data of 10 studies, or an average study length of 8 years. Post design and retention, threaded posts are more retentive, tapered posts are less retentive. Post form and root fracture, threaded posts have greater potential for fracture, followed by tapered post, then by parallel post. Proper post length, round rooted teeth 3/4 of the root length, average root length, leave 5 mm of apical gutta aperture. Molar teeth should not extend greater than 7 mm of the root into root canal apical base. Apical seal and gutta aperture length 5 mm gutta produces adequate. And now these are the few references for this PowerPoint. If you want to take a screenshot, take it. Now it comes as a short essay for you people, basically restoration of endodontically treated teeth. So I didn't want you to make it boring or be it more elaborative. The objective was just to give you a brief idea. If at all you come across your pedagogy topic or a short essay question or a viva, what are the minimum points that has to be covered in this topic? Thank you.